Are you that person that crashes after a sugary meal and just feels so tired? Listen up. So it could be that you're insulin resistant. Now, why is that important? Because insulin resistance is actually the underlying thing that eventually leads to type 2 diabetes or chronically elevated blood sugars that usually end up needing medication or some sort of intensive therapy. It turns out that there's a technical term for insulin resistance that's called beta cell fatigue. Why is it called beta cell fatigue? Well, the beta cells are the little cells in the pancreas that make insulin. And for years before someone actually becomes a diabetic and those cells totally poop out, they're actually struggling. They're trying to keep up making more and more insulin to try to keep an increasing blood sugar under good control. The problem is, as I talked about in my last video, you could have all of this going on and your normal fasting blood sugar hasn't elevated yet. Everything's going on behind the scenes. It happens after you eat, or it happens with these mild elevations in blood sugar over time that aren't just caught every time you do a fasting blood sugar test. So why would it be important to know if you're insulin resistant? Because insulin resistance affects not only your risk of diabetes, but it can affect your weight and your temptation to eat out of turn. That's why I test for this with everyone that I help with weight loss. How do I test? I use two tests, one called the HOMA-IR, which actually looks at your blood sugar, your fasting insulin level, and puts it through a formula to figure out if you have insulin resistance. The other is a test called LP-IR, which looks at how big or small the different fats in your blood are and actually comes up with whether or not you're insulin resistant. These two tests combined together are actually pretty accurate, and it turns out they can be almost as accurate as some of the sophisticated tests we used to do in the past, like putting IVs of glucose and insulin in people and taking multiple measures of their insulin and blood sugar while that was happening, or making someone drink a sugar solution and measuring their insulin and glucose several times after that. So it turns out these two tests done fasting just in one shot can be pretty predictive and almost as good as doing what are called these gold standard tests. So if you've been struggling with weight, blood sugar, temptations when eating, especially if you have a family history of diabetes, make sure you're tested for insulin resistance. This has been Dr. Emmy.